Hi, my name's Sharon Goldby. I'm an accredited hand therapist and occupational therapist. I have a master's in hand and upper limb rehabilitation, and I've been working in this field both in the private and public sector for over 30 years. I've most recently been the Senior Clinician at the Alfred Hospital, where I worked primarily in acute post-operative care of hand and upper limb injuries, including wrist fractures, tendon repairs, nerve injuries, burns, and reconstructive procedures. I'm an advanced practice clinician, which means that I assess and treat injuries referred by general practitioners that may have occurred through overuse or degenerative change like osteoarthritis, nerve compression, or tendinopathies of the wrist and elbow. At times, poor body mechanics can cause stress and strain to soft tissues and structures, leading to pain and loss of function. This may happen while playing sport, through long hours on the computer, when playing an instrument, or just through general home activities. These injuries can be assessed and treated at Melbourne Hand Therapy by myself or my colleagues in a way that will enable you to get back to doing what's important to you. Just a little bit about me personally. I have a passion for building hand therapy services in countries where limited surgery and rehabilitation exists for children and adults who may be impacted by injury from burns or accident or from birth defects. I travel regularly to places like Africa and Asia with surgical teams, training therapists in hand therapy so that these services can be an option for people in their own countries. At Melbourne Hand Therapy, I'm based across 3 sites. I'm in Box Hill, Ringwood and East Melbourne. On meeting new clients, I aim to gather as much information as possible about you, your injury, how it happened, and what impact it's having on your everyday function in life. And after reviewing all of the diagnostic information, I'll make a thorough examination and I'll discuss with you a plan of management. I'll also correspond with your treating medical practitioners. I take the time to explain to each client exactly what structures have been damaged and what to expect in terms of healing timeframes and what needs to be done initially to start the healing process. Now, this may involve splinting, wound care, changes in work practices, or rest. Every injury is unique, and the more my clients understand their injury and have an expectation of recovery, the more they can participate fully in the rehab process. Personal injury is a journey that impacts so many aspects of life, and I like to partner in this journey with you by getting to know you, what's important to you, and how best to achieve the outcomes you need. I understand the impact of injury on being able to do what you love. So I look forward to seeing you at one of the clinics to assess your injury and work out for you the best plan of management.